Okay. Hey guys, Dr. Shoshana here. You're the new patient today, Alana. Say wave to the camera behind you. So Alana has been following Dr. Johnson's work on YouTube for how many years now?
Maybe like 6.
6 or 7, and she bumped into Dr. Leah in Dallas, but like any smart New Yorker, they said, well, if it's in Dallas, it's definitely New York. So she found me, so it's easier to get to, so that's good. We went over her history, we did an exam, we looked at her posture, and we found out that she's got chronic lower back pain, chronic neck pain, and some shoulder issues, right? From multiple car accident, a couple traumas. So we're going to start with the ring dinger and jump into the rest of her body. So take a breath in and let it all the way out. All right, when I put these pins in, I really want them to be tight. I don't want them to be comfortable. As soon as I do the adjustment, I'll take the pins right out, okay?
Okay.
I always love to let people know that it's supposed to be tight, and why they're tight is to hold your pelvis in place. So when you pull, that effect goes all the way down to the tailbone, almost to that part. Breathe in and let it out. Okay, tolerable? Mm-hmm. Okay, try sliding up towards your head, see if you can move. Not much, right? Okay, so what we're gonna do is we're gonna keep your fingers interlocked like this. And we're gonna keep your mouth closed. You're gonna breathe in and out through the nose. Breathe in and out through the nose. I'm gonna do a couple gentle distractions. And when I'm ready to pull it, I'll tell you to touch your toes together or something like that, okay? And then I'm gonna pull, okay? So Dr. Austin's gonna document your face because we wanna see that smile after. All right, so right at the base of your skull. Good, good. Let me move this one a little bit better. People out there, yes, it's wet. It gives me a much better grip. All right, good. So take a nice deep breath in and all the way out. Good. Breathe in again and let it all the way out. Good. Wiggle your toes. Wiggle your toes.
Oh my. Oh my Jesus.
Breathe, breathe, breathe. See, we get a Jesus out of you. Sometimes we get an Allah, sometimes we get an oh my God, sometimes we get a Jesus, but that was lovely.
Yes.
When you felt that, where did you feel that effect?
I felt it down, all the way down.
Okay, because I don't know if you noticed when I started doing the pre-pull, I felt your skull move.
I felt a couple of cracks.
Yeah, your skull moved, even pre-tension. So once we pulled it, completely unzipped that whole spine. So you're happy with that, right? Okay, good. So catch your breath. You ready? We're going to do the rest of your cervical spine,
yes.
Okay? That was amazing. Okay. All lower, lower. Solid. 1, 2, 3, 4. Yes, yes. Stay right there. Good, good. Stay right there. We're going to wait till this comes to a complete stop. I'm going to guide you what we're going to do next. We're going to adjust the rest of your spine on the other table, and for YouTube people, I wiped that headpiece before. I didn't use face paper. Usually when we adjust patients, we use face paper, but people are complaining they don't hear the crunches. So we got rid of the face paper, cleaned the headrest, we'll clean it before and after. All right, so turn on your side facing the window. Turn completely on your side. Great. And push yourself up to a seated position. Push. Swing your legs off the table. Get your balance, because sometimes people get dizzy after that.
Okay.
What do you notice?
I feel lighter.
Okay.
A little lighter in my neck.
Okay.
I feel like my lower back has opened. It still feels sore, but it
Some more work.
feels open.
Okay, stand up now. Different?
Yeah.
Okay, now we're going to do the rest of your spine lighter. You keep on hearing lighter, lighter, lighter.
Yeah.
We're going to do the rest of your spine. What I expect from this is to be sore. So when people leave here, they feel lighter, they feel looser, but later that day, they're sore. Ice is important, okay? Let's go face down. All right, so that was a great first ring dinger. Now we're going to adjust the rest of her spine. And like all this is not miracle work. You'll feel better after today. You might be sore tomorrow. We're going to require a couple visits. Usually what we do, both Dr. Leah, Dr. Johnson, and all the doctors that do the ring dinger technique, The technique is 6 visits done at a very close period of time. Some doctors they adjust their patients twice a day. For you, being that you're close, we can do about twice a week. All right, that left side. So we're gonna start what's called a drop technique. I'm sure you've seen it in the videos. Good. There's a lot of weight behind that, and the table is absorbing the force. So if you really drop into people, not be afraid to hurt them. Breathe in for me, and let your air all the way out. Bend your knees. Bend, bend, bend. Oh, that was lovely. All right, good. Back to the leg check. Much better. I'm gonna come up to the base of your neck. And one of the reasons we got rid of that paper so we could hear this upper thoracic crunch. Wow. Okay, good. Up in there. Breathe in and relax your head, neck, and shoulder down. Good. Breathe in and drop this. Not that loud. There we go. Stay right there. Breathe in and down. Air out, air out, air out, air out. Nothing left. On your back. Flip over. All right, easy, easy peasy. A lot of chiropractors aren't doing this work, but the ones are getting results. All right, so what we're gonna do is I'm gonna unload your lower back, your hip, and your knee. Okay? Let me have this knee. You said this one you're getting operated on, the bunion done on this side, right? Drop this. Big audible there. Relax that talus, foot. Good. Back into this one. Drop this. Perfect. Drop this. Oh, that released nicely.
Yes.
All right. Maybe this elbow. Drop this. Wrist. Good. Thumb. Perfect. Getting your whole body moving today, right?
Yes.
All right. So tonight you're gonna drink lots of water, lots of sleep. Good. Perfect. Now sit up facing the charts if you can. And then we're going to look at your shoulder. I mentioned that shoulder's mission. Sit right here for me. Okay. This is the good shoulder?
Yes.
Yeah. Okay. And this is the one that was affected. Okay, so what we're trying to do is we're trying to get the shoulder to go from anterior to posterior. Breathe in. And let it out. There we go. I know you felt that audible. Okay, now stand up. We're going to do the instrument work. Turn facing that way. Okay, good. Take those arms, open those arms here. Bring your shoulder back. And then we're going to have you hit all of the areas that have a very large amount of nerve receptors with the arthrostim. Some chiropractors use kind of the TMJ. I like to use it on the area with the highest amount of proprioceptors, which is the SI joints, the upper thoracic spine, and the hips. Good. All right, try walking now, up, back and forth, and in your own words, tell me what's different.
I feel lighter.
Okay.
The middle of my back feels sore.
Sore, you gotta be sore. Sore comes with the territory. When we adjust like that, soreness is to be expected. It goes away in a day or two with some ice.
I feel like my shoulders feel more like I feel like I used to feel like
Shrugged.
yes, and now it feels
Drop and relax and
dropped
neutral.
and relaxed, and I feel like my posture feels straighter.
Yeah.
I usually get that pain right here. I don't feel that right now, so
Good things.
yeah.
Okay, so that's a typical first visit. I expect you to be soreness. We're gonna jump off camera and talk about some exercises that we're gonna have you do in between visits, because one of the things people comment is, yes, we give home care. Both Dr. and Austin and I give people things to do in between visits. So we're gonna teach you that off camera.
Okay.
See you next video.